I am just going to stop sharing my screen. I think I have done that now. And welcome everyone to the second event that we have, our second Healthcare Administration Career Pathways event. These online panels are designed to provide current and prospective healthcare administration students at St. Lawrence College with more information about the potential pathways they can choose for their career. And really, who better to get that from than those who are actively walking along those paths, our graduates. So we've got an excellent lineup of panelists today with our focus on the world of pharmaceuticals. In order to preserve bandwidth and to get the most out of the event, we're asking attendees turn off their cameras and microphones until we get to the question and answer period. I also want to ensure that everyone's aware that this event's being recorded and will be shared in various forms, such as through LinkedIn and the Healthcare Administration Facebook page. So each of our panelists has prepared some introductory comments to provide you with an overview of their individual pathway. And following the introductions, we will open to questions. This is a unique opportunity for you to make direct connections and to hear from graduates who are now finding their way. You can ask a question by using the raised hand button on your toolbar. You'll see that on the little toolbar that pops up. And you can also type a question into the chat box. So if you see the little quote icon, you can type a question in there as well. Okay, so our first panelist, I don't think has been able to join us yet. So we're going to go a little bit out of order. So we're going to ask Nick to come up first. So Nikun Tandel has a master's degree in clinical research and a postgraduate certificate in pharmacovigilance. I can never say that word right. He graduated from St. Lawrence College in 2018, and I think he's probably traveled to more places in Canada than I have. Nick works as a pharmacy assistant in Anguanada and at Walmart, and Nick stands out to me because he's always thinking and he is always on the move. So I am going to turn it over to you, Nick, for some introductory comments.
Okay, thank you, Julie, and good afternoon, everyone. So I'll just start with my educational background and how I end up coming to Canada.
Perfect.
So I've done my master's in clinical research back home, and then I did my post-graduation certificate course in pharmacovigilance back in 2012, and then I started working for two American multinational organizations, Amgen and Alexion. I worked there for over 4 years for their pharmacovigilance activity back home. So I was the point of contact for their pharmacovigilance activity based out of India. I was handling 30 people back home under the quality management team. And then one day I realized that, okay, I am handling people, but I need some management experience. And then suddenly I came across healthcare administration program in Kingston St. Lawrence College. I looked at the program design and I felt that this is the best opportunity for me to learn the administration program. And at that point of time, I have never thought that I would immigrate to Canada. I just thought of study and then gain some experience working in Canadian healthcare organization. I ended up taking that course. I came to Canada in January 2017. I would say the healthcare administration program was perfect for me because it has everything which I was looking for when I was working back home. It has the leadership quality module, the management aspect, some financial things, and the broad spectrum of Canadian healthcare system. And before joining the healthcare administration course, I had no clue about the universal healthcare in Canada. I learned a lot in Canadian healthcare system about Canadian healthcare system. The program was very good. It enhanced my management skill and leadership skill. While I was in school, I started to work in pharmacy as an assistant since July 2017, and I worked And once I got my work permit, I felt to continue working in pharmacy. Uh, I started with New Day Pharmacy, which was basically deal with the methadone and the addiction related issues. Then later I started working for Walmart, and currently I'm working full time at one of the, I would say, Julie would agree that the best organization in Kingston, Ongwanada, uh, in the pharmacy department. They are so the Ongwanada deals with the people who have a developmental disability. So usually we do with deal with the it's a very different environment of working. It's not like a retail pharmacy. It's mostly the community and the nursing home type of setting, hospital setting, I would say. So we usually deal with the our clients. We have 10 to 12 nursing home, so we do the daily packaging of medication and all their the other requirements related to the clients. I'm looking forward to get my license as a technician very soon. So that's a nutshell about myself.
Fantastic. Thank you very much, Nick. I'm sure there will be questions for you
Mhm.
once we get into the Q&A phase.
Yes.
All right, thank you. So we'll next go to Mitali Shah. Mitali has a master's and bachelor's of pharmacy from India, and she's working as an administrative assistant presently at Avila. I'm not sure if I'm saying that right. Avila Wellness. While at SLC, she was the chief election officer for the Student Association, and also a customer service associate at Walmart. So similar to what Nick has said, Nick experienced, sorry, I've not said, lots of part-time jobs while working as a student. Matali stands out to me for her drive, her ambition, and her ability to connect people with one another. So Matali, if you'd like to say a few words now.
Hi, Julie. It's been a pleasure to have us here to share our stories. Talking about myself, I have, as Julie mentioned, I have done my master's of pharmacy in pharmaceuticals. When I was working back home, I worked for a renowned company, Renbaxi, as an apprentice. It was an entry level position to the pharmacy career. Uh, Working over there, then I decided that I wanted to move to Canada for my higher studies. I hunt for various courses, and then I come around to a administrative course of healthcare administration in St. Lawrence College. uh, the course itself gave us a brief introduction of how the Canadian healthcare system worked, uh, and how we are being able to inculcate our skills in terms of how we can do leadership skills, as well as how we can build up our communication skills, which is really important when you look for a job in any of the fields. uh, I was been in I was been in touch with Julie for a long time to look for some volunteer opportunities as well as training. I worked as a dispensary assistant, as Nick mentioned, in a compounding pharmacy. Similar to that, we used to dispense methadone for the retrieval of for retrieval of narcotics. Apart from that, the part-time job helped me to understand about my pharmacy profession. I came to know that pharmacy profession in Canada is regulated by PEBC, which is the Pharmacy Examination Board of Canada, and moreover, it is a provisionally regulated profession. So each and every province has its own requirements, but yeah, it's an highly paid as well as an highly renowned profession, which is the curriculum is quite wide and complicated and is more focused on the clinical background, uh, as it is not in some of the countries. So it is different in Canada, and it is one of the most famous, or I can say most beneficial profession in terms of healthcare uh, in North America. So I think that is the that made me think about to move to Canada. Moreover, I'm working as an administrative assistant, where I'm working as in front desk and utilizing my leadership qualities as well as the communication skills which I learned at St. Lawrence. Here, I would like to mention that St. Lawrence College has lots of resources, and the career services helped me a lot in drafting the resume and the cover letter. So these are the simple steps which we took as a student to achieve where we are. So that's my journey.
Excellent. Thank you so much, Mitali. Again, I have lots of questions. I'm sure our participants do as well. So we'll be back to you. All right, our next panelist is Clinton Thomas. And I think you pronounce it Joe Clinton Thomas. And I know you go by Clinton, who is a pharmacist trained in India. He graduated from healthcare administration earlier this year and was probably one of the first folks to begin working full-time right away. And you are working full-time in booking and registration with the Nova Scotia Health Authority. So Clinton stands out in my mind as someone who I really would refer to as a very quiet but extremely effective leader. So Clinton, over to you.
Good afternoon, everyone, and thanks for the wonderful introduction Julia did about me. And my name is Joe Clinton Thomas, and I usually prefer by Clinton. So I just finished my Doctor of Pharmacy from India, a 6 years course, and I nearly worked 1.5 years in India. Then I came to Canada for healthcare administration. So when I was doing my pharmacy in India, I thought to make a PG diploma course in somewhere outside India. So after completion of my other course, I joined for pharmacist in India for 1.5 years. Then at the time, like I was lacking behind the account and all the administrative abilities. So meantime, when I was looking the opportunities regarding the pharmacy in Canada and other country, the first preference came is Canada. So one of my friend was there in Canada, so I contacted him and asked about the pharmacy and the exams and all the stuff. So he advised me to take a course. So it will be better to start a career in Canada rather than directly coming here for PR. So he told like better take a course, just study well and make a career in that course. Then if you want, if you're happy with that, you can continue with that course with the job, or else it's better like if you want to change your career to pharmacy, you can go for it. So I just took that course, healthcare administration. It was a good one, and I still remember like policy making and critical thinking because I was recently graduated, so I remember everything. So the critical thinking and policy making and all the stuff. And coming to the best part of healthcare administration, like we'll come to know what all the Canada is lacking behind the healthcare system and what all things Canada is good at. So we came when the people like we were having nearly 70 students in our class. So we were two batches. So I think this batch was the most number of people they had. I think so. We had a good people like circle around, and we had a capstone preparation that was like 4 members in one group. It was like interaction was so good, like we started a query online one, and also questionnaire type we done, and everything was good. And after completion of my course, I was planning to move out from Kingston, even though I love that place. Like we have to move for the job, right? So when I searched in for the job in Halifax, Nova Scotia, so I thought like I'll move to here and I'll start for a job over here. So then I moved to Halifax at the time of pandemic. I still remember like in New Brunswick, they didn't let me in. So I showed my all the details, and then only they let me in. So so at the time of pandemic, I moved here and I just started applying for this job from January 2020. And after 4 months, I just got a call from Nova Scotia Health. And it took me 1 month for the procedure and all the stuff to join over there. And currently, I'm working as a booking and registration clerk for the blood work over there. So we will be calling through patients and doing the clerical works in the blood work and all the dealings with the blood work and the appointment and the blood result and all the stuff. So right now. And that's a brief note about me.
Excellent. Thank you very much, Clinton. And we're going to have more questions for you as well. Excellent. So our next speaker is Akhil Gopal. Akhil's a pharmacist educated in India with 4 years of clinical experience as well. He graduated from St. Lawrence in 2018 and is currently a program coordinator in the HIV IDU, so intravenous drug user, I think, harm reduction and HIV prevention programs at Warden Woods Community Center in Toronto, or Scarborough to be more clear. Akil was another quiet student. It's a bit of a trend with these pharmacists, or maybe that's the difference between pharmacy and the dentists, I'm not sure. Akil was featured by the United Way in the Toronto area earlier this year for the important work that he's doing, and I couldn't be more proud of him. So Akil, over to you.
Thank you, Julie. Thank you for having me. Hi, everyone. My name is Akil, and as Julie said, I'm a doctor of pharmacy graduate from India, and I moved to Canada. I have a plan to move to some, developed country from India, and I thought of Canada. Then it's pretty easy to move to Canada with a student visa rather than a permanent residency visa. So I thought of doing a program in healthcare administration. And to be frank, I'm so excited. I was so excited about St. Lawrence College in Kingston. And before coming to Canada, I thought of Kingston as a small town compared to Toronto or Toronto. So I have some, judgmental things about Kingston, but everything changed when I landed in Kingston. And Kingston was so beautiful. St. Lawrence, Queens, it's like a city with a different vibe and all. And after my studies in St. Lawrence, I moved to Toronto, and I felt that Toronto is like, oh man, Kingston was so wonderful. I should not have moved to Scarborough or Toronto. Yeah. Anyways, it's been great while I was in St. Lawrence College, and being a pharmacist for about 4 years after my studies in India, and I was having a plan to get through the PEBC licensing exam and all, but everything changed when I got this job. To be frank, I quit my plans for giving PEBC exams and all, because I'm not discouraging anyone, because everybody is having their own career paths. Most of the students who are attending healthcare administration, I mean the pharmacist background students, they may be planning for a PEBC licensing exam and all. So what I want to tell new students or ongoing students is that the licensing process is a long process. Like it takes 24 to 26 months, like 2 years, if you're getting through all the examinations in the first attempt itself. So it's a long process. So you need to survive in Canada. You need to keep your career growing. So St. Lawrence and Healthcare Administration will play a great role in that period of your time, because you will be able to get more jobs if you have a healthcare administration degree along with your pharmacy degree from India, because people are looking at somebody who is actually having knowledge, or somebody who is trained in Canadian healthcare, or even studied something about Canadian healthcare during the non-licensed period of your career. And that at that point, I mean, this period, definitely St. Lawrence and healthcare administration program, and things that you gain from St. Lawrence will definitely help you. And I'm a great example. I'm really proud of being a St. Lawrence student, because I got this job not because of my pharmacy background or my doctorate in pharmacy degree. It's only because I done a healthcare administration job. Because even today, like when I have a team with me, and even when we are hiring for our team, we look into different people, like nursing background students or pharmacists or any healthcare background students. We are not actually looking at their real professional background like pharmacist or a nurse, but we are actually looking at their ability to do things. So, or their healthcare administrative ability or their manager ability. This program will definitely give you something great to survive during this period. And also, why I dropped my plans for is that, as I told you, you have to invest 2 years to get through this licensing process. So what if you invest this 2 years in building your career in management or in administration or in any other healthcare field? Because I believe that my senior managers are getting paid uh, for the same salary of a pharmacist, compared to a pharmacist actually. So they're getting the same salary. So what if I can improve myself with, or what if I can improve my ability to do things as a manager or a senior manager in 2 years, rather than investing uh, in the real licensing processes. Both may be different for different perspectives. I accept that, but for me, with my St. Lawrence studies and healthcare administration studies, my concept of my own career has changed. Now I am more into management or healthcare administration, but always I encourage pharmacists back in India or pharmacists coming to Canada to go through their licensing process. Another thing that I wanted to bring into picture to new students is that after the completion of this course, you have a lot of QPIC jobs. QPIC means qualified person in charge. These jobs can be either in pharmaceuticals or in different community health centers, or any place which is related to healthcare. So it's called AQPIC jobs or either QPIC jobs. AQPICs is called alternative qualified person in charge. So you don't need a license to practice in these designations. You just need your equivalency, your pharmacy education equivalency to be done in Canada, or you just need the evaluation done by the Pharmacy Council sorry, the Pharmacy PBC actually. You just need the evaluation done. So with that and the healthcare administration PG diploma or graduate certification from St. Lawrence, definitely there is high chance and probability to get into those jobs. So new students or students who are about to graduate or others, you can also look into these kinds of jobs. There are plenty of those jobs in GTA. You cannot find those kind of jobs in Kingston because, as you know, Kingston is a very beautiful city, but there is less opportunities compared to other bigger cities in Canada. So these are the sectors that new graduates, care graduates can look into, rather than going back to the profession, or I mean, maybe if you are already keeping with the profession, like I know many people who are working in pharmacies, like pharmacy assistants and all. um, I always appreciate those people because they have been in their profession even when they moved to another country. But unfortunately for me, I couldn't, get into a pharmacy or something, because even I was driving cabs, like I was in with the Amy's taxi in Kingston, or while I was studying as as a part-time job. So it's all part of this journey from India as a pharmacist to a pharmacist in Canada. So I believe healthcare administration in St. Lawrence will play an important role. Utilize that there is a great resources available in St. Lawrence. You have great professors in from every field actually, and it's all a learning process. Even now I'm learning from my staff, because most of my staff are basically BSWs or MSWs. I'm not in that field, but being a coordinator for them, even now I'm learning things from them. So this is kind of a great learning process from between this period between your studies in St. Lawrence and once you're being licensed as a pharmacist, it takes about 2 to 3 years. So this period is really crucial, and you have many directions to go. Choose one of them. St. Lawrence will help you in that. Yeah, this is a small bit description of my journey. Yeah.
Excellent. Thank you so much, Akil. There's lots of nuggets of information in there to grab. Before we go away from you, though, I'm going to throw the first question to you. And I'm just wondering, how hard was it and how long did it take you to find your job after you graduated? And I know you mentioned Cupic Jobs. I've never heard of that term. So if you could tell me a little bit more, is it a web-based?
No, it took about 5 months for me after graduation from St. Lawrence because I thought of moving to GTA after my studies, but that doesn't happen immediately because I was a little bit short of my money and all. So we need at least $1,000 with us to find an apartment or or a place to live in GTA. So it was really difficult for me to move from Kingston in the beginning. So I waited around 3 to 4 months, but I keep on applying to jobs. I was applying to almost many jobs in Indeed, and I got few interviews. I traveled from Kingston to Toronto for my interviews, went back. So I think this was my fifth interview that I got selected to this. But few of my friends, they got it all at once. That they cracked their interviews all at once, and they joined after 1 month or 2 months, I think. But for me, it took some time because I waited, because it was a smooth flow in Kingston. Like I was in my comfort zone in Kingston, so I don't want to move to some other city. I thought of getting a job I tried to get a job in Kingston itself, but that doesn't happen. That's why I moved. Anyways, and about the Cupic Jobs, actually, mm, the thing behind Cupic Jobs is that if the companies or agencies hire a licensed person, they have to give the salary, the basic salary of that particular profession. That if they're hiring a real licensed pharmacist, they have to give at least $35 per hour. So if alternatively, if they hire somebody who is having the degree but not the license, but they don't want to go to the patient directly, or they don't have any direct patient interactions, they don't need a license actually. So these are jobs which you can find in different community health centers, agencies, even pharmaceutical companies, quality control, all those things. This pays much above than a general administrative professional, like entry level administrative jobs, because this pays around like $28 to $30. So there are many opportunities in GTA, but I don't know about Kingston. These are kind of surviving jobs that you can go into or look into during your pre-licensing process period, like the 2 years from your the 2 years that you need for getting licensed. So and also these jobs can uh, evolve for each and every one of you. Like you can grow from those designations as get promoted to senior designations, and definitely it will somehow help new graduates or international graduates in Canada, who are landing in Canada, and also they are actually looking at someone who is having any kind of administrative degrees or background, or even I have students with me from Ryerson University and Centennial College. They are also struggling for the same thing, even though they have MBAs with them. But initial jobs are pretty difficult for them to get into. But for a graduate from St. Lawrence College with their pharmacy degree, I think we have more opportunities than those people who are actually doing MBAs because of these cubic jobs. So definitely people can look into these kinds of jobs in GTA. And also, what shall I say? I can tell you my example. If what my agency is looking out from me is that they don't want my pharmacy experience, or they don't want my pharmacy knowledge. They just need what I gained from St. Lawrence. They need someone who can control these things and execute things. So I think that kind of an ability, or that kind of knowledge that we need to project ourselves, and that I got that only from St. Lawrence, because I was not aware about most of the Canadian healthcare systems. So all those things, even the things that people ask us during the interviews, all those things I gained from this healthcare administration program.
Great.
Even like, yeah.
Thank you so much, Akil. That's very, very helpful information. I'm going to switch gears a little bit now and go back to Nick, who talked about getting licensed as a technician. And Nick, if you could tell us a little bit more about what those steps look like and how that process looks. I know you were not, your background was in research back home, so I know you've got a bit of a different path.
Yeah. So until 2018, there was a pathway for like people who were working in pharmacy as an assistant, but they did not have like any license. Until 2018 there was a thing from PEBC, like if you have a certain number of hours, like 2000 hours, you can directly apply for technician licensing exam, but they stopped doing that. So now there is two options for people who wants to be a technician. So the one is, if you are pharmacist back home, you can get your education evaluation done, and if you appear in the initial exam and if you passed, then you can directly write an exam for technician. Second, if you are not pharmacist back home and if you want to be a technician, so there is no other option rather than going to school. So you have to go to the school for uh, there are there are various college who offers pharmacy technician course ranging from 8 months to 16 months. So you can go to the school for a program, and then once you finish the program, then you can write the technician exam. So in Kingston, there is one college, Kingston Learning College, KLC. So they offer a 12 months technician program, which is mostly focused 8 months on the school part. So like mostly it's online thing, or sometimes you have to go to school, but since we are in pandemic now, I think they are only doing online. So 8 months you are doing the school work, and then 4 months you have to do an internship in the hospital, 4 months. And then once you clear that the program, then you are eligible to write the pharmacy technician exam. And then once you clear, then you have become a licensed pharmacy technician.
Excellent, thank you. All right, and Mitali and Clinton, I think you're both pursuing your pharmacy exam Board of Canada exams. I'm not sure if either one of you wants to speak to what that process looks like and how it's going, if you have some tips for some of the current students who are interested in it.
Okay, so when I was studying for the healthcare administration, so I started doing my paperwork like document evaluation. So it took me 8 months to do all the things like sending my transcript from India and my college to here, and it's nearly 8 months. So I prefer like the students who have to or who want to write exam, try to do the paperwork or the document evaluation when you're studying in the college, so you can save the time. Like you can plan after completion of the course, if you want to move with the job, you can move later on, you can save time for this, like for the document evaluation. And also for the starting for the document evaluation for exam, like you can go to PUBC, it's a pharmacy examining board of Canada. Just go to that site and you can they has nicely written everything about how to do and the things, what all document you need to do for your evaluation. And you first one, we have to start a ID, NAPRA ID, that it's like a online making a ID. So you have to go there and you want to give all your details and make a ID, and there is also payment for that. You have to pay, and after making that payment, you will get a ID. It's so called NAPRA ID. Then you want to come to PUBC website, and there you have to make a uh, online again. You want to make a details like your name, which college you studied, and all the things, your degree and all the stuff. And from there we want to give a requisition for the document evaluation. And then you will be getting a PDF format. You want to take a print, and all the things they are written like you want to attach a photo, and it should not be older than 12 months, I think. Yeah. And we can send it from our place, like they want our degree certificate, and everything should be notary attested. And also we want to send some graduate some certificates from India. And I think it will take 8 months, all this process. So I think it's better to start early so that you can save some time. And later, once you get the document evaluation form, they will send a email, and everything is occurred to the email and your account, so you can check your account. And also they will send a letter and to your mail once it is approved. Then once it's approved, like next step is like you can take exam. Like once the first one is on Jan, and the other one is on June. Total we have 4 exams, and first one is PUBC exam, like evaluation exam. So it's happened in June and January. And you can apply just 4 months before. And even for that also we want to apply just 4 months, I think, 4 or 6 months before, and prepare well for that. And we have only 3 attempts and 3 chance, so don't lose that. So it's better to study well and apply. Like if you are not confident enough, I think before 2 months you can change the date. Right now they're allowed to change. They're giving chance to change the date because of this pandemic. So if you are good enough, and if you know that like you'll pass, then you can give exam. But and also there is a different people like who are giving the coaching, like coaching centers. They're giving online and as well as the in class coaching centers. You can if you want, you can take class with them, and you can give exam. And that's in short, like if you want to apply for exam.
Excellent. Thank you very much. Mitali, do you have anything to add to that? Any tips? I think you're on mute if you're joining. Oh, we might have lost her. Oh,
yeah. So I just want to add 2 things, that it's a long process, and I think you need to prepare for it, plan ahead, as he said. Apart from this, I think there are lots of myths about how to generate the documents, like how to get it. Each and every individual has their own requirement. If you're licensed back home, you have a different procedure. If you have never been licensed, it involves a different procedure. So it depends on individual and individual. Now they're easing the requirements as they are accepting the electronic transcripts, which has made it easier. So you have to connect with the PBC people and the coordinator there to know what exactly you need. And I waited for at least 8 months or a year to get my documents. But when I came to know I was requiring something else, and I did waited for something which was not being required. So do a specific research. And yeah, the course is wide. As I mentioned, it is more about the clinical practice. So I think sometimes people lose their interest. So I think perseverance and hard work is most important to set your goal.
Good. And is working kind of part-time as a pharmacy assistant, does that help you kind of in preparing, or?
Yeah, it prepared me in terms of to know, because when you see a pharmacist working, you come to know what are your job roles going to be. Moreover, it helped me to understand the system. Like, it is totally different from our countries. We are just there to dispense, but here there's one more part of the practice, which is consultation. You need to let the patients know, or let the patients know about what would be the adverse effects or what could be the causes of your disease. So I think, as I mentioned, you need to have a proper roadmap of what you are going to do in your profession. Apart from this, working in the pharmacy helped me to know what were the classifications of the drugs. There are because Canada follows the US guidelines, as well as India has its own guidelines. So when you look at the whole world follows the American pharmacopoeia or the US pharmacopoeia, which I would mention. And I think this is what the Canada has adopted. Also, it has its own Canadian pharmacy index, but I think, yeah, the guidelines and the regulations of dispensing the drugs and administering them are different. There are also main courses. There are also some courses which you can do after after you are a pharmacist or you have succeeded in your profession. Like, Ontario has its own requirement that you need to have a license to inject the vaccines. So this is an additional requirement of Ontario, which I think, if I'm not wrong, it's just for Ontario and not for the other province. So keep upgrading yourself on your profession. You might not end up to be a pharmacist, but I think there are ways available to switch your careers.
Excellent, great advice. Just wondering if any of our panelists took advantage of any of the forums or the help that can be provided through Health Force Ontario when trying to figure out their pathway. Did any of you reach out to them?
To reach out to whom, Julie?
Health Force Ontario, the provincial agency that works with internationally educated professionals.
Well, not me, but I have heard lots of my friends reaching to them, and each because our credentials are not evaluated, it becomes hard for them to give us the advice. They just want us to go and seek information with our councils or our examining boards. Working in a licensed profession, or I can say a regulated profession, your best point of contact would be your seniors or your alumni who have passed out from that profession. Apart from this, there are also some bridging programs run by the University of Toronto, which will help the recent graduates to do a certificate program in the profession. And a lot of them are accessible, they are free, and most of them are there to help you communicate with your employers as well as with your professional bodies.
Excellent. And my next question really is open to all of you in terms of finding the right jobs for the fit and the way that you have either gotten permanent residency or your pathway to permanent residency. I understand that it's sometimes a challenge to find those right jobs. So not sure who would like to speak to this one first.
Well, if I would like to go first for this, because as soon as you graduate from the course, you just are in a search of job, and you conclude one day that there's no opportunity in Kingston or in Toronto or in some other province. Uh, as you graduate as a fresher. So in order to get more experience, or in order to get a job, I think you have to create your opportunities. Look for a volunteer opportunity, as I mentioned in my introduction as well. Looking for it on hands-on training. uh, Go at least 2 hours or 3 hours to Providence Care, or any organization which will help you to understand what is the structure of their working, how you need to work. Apart from this, it helps you to build contacts, and as a fresher and as an immigrant, you need to have a strong network with people. With as you start interacting with people, you come to know what are the shortcomings uh, you face, or what are the shortcomings are there that you can overcome and succeed in your career.
Uh, I want to jump in here. So yeah, as I Mitali mentioned about volunteering opportunity, yeah. So I recently become permanent resident in June. So yeah, so usually people when they start program, they just right away want to work. But I would say when I joined the program, I did not work for 6 months, and instead I started working as a volunteer as Providence Care. Those volunteer experience really helped me getting job, because what happen is if you go for a volunteering work, you see a lots of people over there, and Providence Care Hospital in Kingston is the great opportunity to meet all kinds of healthcare professional, like everyone, doctors, pharmacists, nurses, physiotherapists, everything. This is the best place if you want to make a connection, or if you want to connect with people who you would like to become in future. So yeah, the best thing to start when you are in college, you start spending your time as a volunteer. It will not give you money, but that would definitely give you, the great fruits in the future. So yeah, that's the one thing. And yeah, once you finish with your job, you want to start looking for a job. So for the permanent residency, you need a job in A or B category. So you want to start searching for those jobs, and after 1 years of Canadian experience, and if you have enough score like English testing and everything, then you can be eligible for permanent residency.
And was that a tough journey for you?
For permanent residency,
Yeah.
I would say, yeah, yeah, it took me like over a year. Uh, yeah, that was a tough journey, but the advantage of because I had worked back home for over 4 years, and also I had a master's degree back home, so that adds up, and then your IELTS scores. So if you are just a bachelor's back home, and if you gain Canadian experience for 1 year, I would say sometimes the scores doesn't make enough to eligible to apply for permanent residence. You may have to work 2 years in order to eligible for permanent residency. But yeah, like if the for permanent resident, your age, your uh, your education background, your work experience back home, your work experience in Canada, plus your English language test, those all adds up and then give you score. But yeah, it was a tough journey, but it was a great experience, I would say.
Excellent. Well, and you certainly got it within your 3 years.
Oh yes, yeah, yeah.
So, yeah.
I know people who in our like there are so many people back in during my course, almost everyone now getting permanent residency. So that's a good thing. Some people they got the job right away. That's the good thing about the healthcare administration program. I would say it's a great program. It has everything. The best thing about program, the all the professors who are in this program has all have their experience in healthcare organization. They are just not academic, but I would say they had worked in the healthcare field, so they have like tremendous experience, and they are very knowledgeable, and they guided us. And yeah, that's a
Excellent. Sorry, I'm getting some feedback. I've noticed that Pavna has joined us. And I know she was having trouble linking in earlier. So I'm just going to quickly introduce her, and hopefully she can jump on the call. So Pavna has a Master of Pharmacy, Pharmaceuticals and Drug Design from Punjab Technical University, and has several years of experience within the pharmaceutical industry. And while at St. Lawrence, she worked part-time at Rexall, at Shoppers Drug Mart in Kingston, as well as as a pharmacy assistant and as a pharmacy tech. She was a full-time pharmacy tech in Mississauga, and now is a reimbursement specialist with the patient support program for Alio Health Services. Pavna's kind of the whole package. She's goal-driven, she's compassionate, in every sense, she is a professional. So I will turn it over to you, Pavna, if you want to share a little bit about your journey.
Thank you, Julie, for giving me this opportunity to share my experience with all of you guys. And I appreciate you guys that you have given me a chance to share my experience. And I saw this Angie is on the call, so I would really uh, I want to say thank you, because she is the one who was my helping hand in the whole program when I was in St. Lawrence in healthcare program. So I would start like when I start the joining my program in 2017. So I came in May session. So within a week, it was, you can say it was my luck or something with my background. I got a job with Rexall. So I started working with them as a tech assistant, pharmacy assistant. So side by I was attending my classes as well, and I used to go to the Excel. And from there, my journey starts with uh, administration studies with my experience. So I was taking both, means I was joining together. So anyhow, so I finished my course, and then I moved to Mississauga because of my family reasons, and I started working with Rexall again. I was continuing Rexall, so I take a transfer from Kingston to Mississauga. So I was working here since 2018 as a technician, full-time assistant, pharmacy assistant. So recently I got a job opportunity, and I'm working with a pharmacy patient support program with Alio Health Sciences. So it's a kind of a support program that provides the mm, patient reimbursement solutions for the patients who cannot afford the expensive medications. So I'm taking care of the three different programs: one asthma program and oncology, and one is for the uh, chronic urticaria. So these three areas I'm taking care of all. So, and because I got this in job because I did my studies in the administration in St. Lawrence. So this the course means the whatsoever the things I have learned over there. So I collaborate with my pharmaceutical education. So that's why means I was able to get this job. So like for my PR journey, so like Nikun shared his experience. So I was having 7 years of experience from back home in the pharmaceutical sector, and then when I moved, when I started working in the Rexall, so my pharmacy manager he suggested me that you can apply for the PR as you are having several years of experience from back home. Just finish the program and write your IELTS. And if you can get the good score, you can get the PR within a 6 months. So I followed his instruction, and when I finished the course in August 2018, and at the same time I wrote my exam, and luckily I got eight each. And then after that, we applied for my PR, and within a I think 3 to 4 months I got my PR. So means I was searching for the jobs means in the meantime because I was not satisfied with the technician job. So I was planning to write my license exam as the we are means no means I searched that we means Canada is kind of a demanding option for the pharmacists. So means I started preparing for my exam as well, and for now means as for now I have finished my two of the exams. I'm left only with my internships. So probably from 6 months onwards I will be licensed pharmacist hopefully. And this is all from my journey from 2017 to till now. And means I would suggest to the newcomers and the students when they come here in Canada, and I no doubt this program is very good program. They just have to collaborate their skills with the administration skills you can say. And means like we have so much like risk assessment course in our program. And Julie means for today I have no idea who is taking care of that course. Like in my tenure I remember Julie was the main coordinator for the communication programs, and she gave a lot of stress to on us to improve our communication skills and how we have to dig up, how we have to match our profile means our resume with the job profile, if they are how we have to collaborate and how the skills together so that we can apply for this specific job. So those things means I kept in my mind and keep on applying for the different kind of jobs. So means I would say for the new graduates or the whosoever that taking this program means they can open they can widely open their arms. Because some people only thinks that if we are from the pharmacy background we can go only for our license exam. No, there are a lot of sector in Canada, in Ontario especially. There are a lot of things you can use means like with the marketing experience you can go into the marketing. So there is a huge package as means you can compare with the licensed pharmacist and the pharmaceutical marketing. Or you can get with the administration program you can get in the big hospitals. Means if you don't get the chance to work for the big organization, start from the smaller one. If you get in the smaller one you will get to know the a lot of things, a lot of experience, because the small things you learn a lot of things, and which you can comply for the big organization. And on the other side, like if you are working with the drugstore chain, drugstores or private drugstores, so from there with the when you pass this administration program you can get into the like patient support program. Means in Canada, whole Canada, most of the big pharmaceutical companies they are having patient support program. If you are having the some little bit of 2 or 3 years of experience even in the drugstore, even in from back home with pharmacovigilance or quality assurance, quality control. So you can compile your previous experience with this administration studies, and you can apply for the good for this kind of programs. And means no doubt there are a lot of opportunities, but you have to, like I already said, that you just have to open your arms wide, because don't stuck to the specific area that I am in Kingston, so I will be working only in this area, or my I can move maximum up to 100 kilometers only. No, no, don't think like that. You can move, switch yourself from one place to another just to get into a good job. There are bulk of jobs, you can say, that means not even in the metro cities, but even in the small cities, like if you plan to move to Montreal, it's nearby to Kingston, there are bulk of jobs with the pharmaceutical experience. So in the nutshell, I will suggest means just open your arm and keep on applying the just compile your administration studies with your previous experience, and you can get into the new workplace.
Fantastic. Thank you so much for that, Pavna. That's super helpful. And I think what you've experienced and what you've gone through is really helpful for other students as well. Hearing that you're just at the clinical stage now and you're very close to becoming a pharmacist is extremely exciting. Just wondering if it's helpful for someone to have their PR before they start their exams, or does it really matter?
No, it doesn't really matter actually. Means you the Nikun, he told earlier, like if you have experience, at least 2 years experience from back home, when you finish the program, just right away give the IELTS exam. Just focus on 8 each or 8,777, 8 in listening and other 3 modules 7, and they can apply for the uh, federal skill work experience class. And and if students they don't have any experience in back home, they just, if they just got graduate and they came to Canada, when they finish their program, and they can focus to get a job in NOC category A, O, OA and B. So in these categories means most of these graduates, they like my all of my batchmates, they got as a dental administrator, or in the healthcare, like walk-in clinic as a medical administrator, or means in the means administration job, that is a NOC B category. So if they get the NOC B category job, and with after 1 year of experience, they can write the exam for the IELTS, and same requirements 8,777 for the English test, and they can apply for the job. And third option is that if unless means they tried their best and they think that they didn't get any job, they can get now recently three in this COVID time. So Ontario government, Doug Ford, they launched a program, like if you are working for a, even it's a labor job, or means, but you are working in the same organization from from the day you started working in the Canada, you have to continue with the same organization for 2 to 3 years, and your organizer, your employer, they can offer you letter, it's called means employer offer program, job of support, something like that. So they can get a job within a 6 to 8 months. And fourth is like LMIA option. So if they are not having a OAB category job, they have NOC C and D level job. So they can go for the LMIA support program. It's different, and their employer has to sponsor, and they have to pay for everything. They have to show their revenue budget, and they have to show the paper, something like that. They did not find anyone, and that's why they are sponsoring this student or this guy or girl for this job posting. So in that way they can apply for the PR.
Excellent. Thank you so much. And I'm just looking at the time and realizing that we are a little bit over kind of the hour that I've asked you guys to be with us. But I'm wondering if each of you can kind of think of any comments that you'd like to express, and we'll go through the group once more, just in closing. And I do know that before we do that, Angie is with us and does want to say something. So I'm just going to open the mic up to her for a second.
Hi, guys.
Hi,
Hi, guys. How are you?
I'm good. How are you?
Good. It is so wonderful, hey, to see familiar faces and hear familiar voices, and you're absolutely such ambassadors for this program. Your information is so valuable. I know Julie has thanked you, but I want to thank you again. You make our days when we get to see you again. You really do. So that is so awesome. I had one comment that I wanted to, or one question that I wanted to kind of jump in and say. So thank you, Julie. What I would really like to know is, what is your one takeaway from the program that you were in? And if you had one piece of advice that you would give to future or current and future students, what would that be? So think about that for a sec, but it is, again, it is so nice to see you all. And I'm going to just say that it looks like everyone is doing well. And Julie and I, we're so proud of you.
Thank you.
So I'm going to go back off camera because this is about you. But anyway, I'll turn it back over to Julie. And so think about what I just asked. Okay, guys? Take care.
All right. So Akil, we haven't heard from you in a little bit. Do you want to provide the one piece of advice that you have for future students, and any closing remarks that you'd like to make as well?
Yeah, it's been great while I was in St. Lawrence, and the entire program was great. And one takeaway was, I learned a lot about Canadian healthcare and things like that. And all those things have, give me different opportunities to, get through things. No, even when we are, doing things in my department, I go back to my folder SLC folder and check things how it's done. So that administrative knowledge is still that was one thing I gained, and I still be proud of that I became a part of St. Lawrence, and I got an opportunity to do that course in St. Lawrence. So that's one takeaway, and I wish all the pharmacy aspirants and maybe I think I deviated from actually encouraging every pharmacist to go through the licensing process, but really when you complete course health administration course in St. Lawrence, two pathways will definitely open before you, and it's up to you to choose. And I can say that both being a pharmacist as well as being an administrative professional with the help of healthcare administration graduate certificate from St. Lawrence, both will provide you same kind of opportunities. Like pharmaceutics licensing takes 2 to 3 years. Being to get evolved as a senior level or a manager level administrative person will also take 2 to 3 years. So both will give you, both these pathways are opportunities before you. You're free to take. It's up to you as the time evolves or how things turn around after the completion of this course will definitely will make you in a situation to choose between these two. And I wish everyone, each and every one of you, best of luck, as well as best of future, best for all your future plans. Yeah, thank you.
Excellent. Thanks so much, Akil. Clinton, over to you for any advice that you have for current or future students, and any closing comments you'd like to make.
Yeah, I still remember the Angie. She used to divide the class, and we used to separate like 6 members in the group, and we used to discuss a topic, and someone from that group have to be answered for the question there'll be 6 or 5 questions and we have to answer that. That's a great takeaway for me. Like we used to discuss a lot in the group. Then teamwork, the leadership quality also increase, and also the fairness about the answers. Usually we'll in India, back in India, we are afraid to ask questions and we'll feel that maybe our answer is wrong. And here when we started studying here, the culture is different, and like we came to know that like there is no wrong answers. Like it will different types of thinking, that thinking is different, like critical thinking and all the stuff. So that's only that's a great thing which I took from there. Like there is no wrong answers. And one thing I want to mention that when you're making a resume, just use the students helpline. I mean, in St. Lawrence, you can go there and they will help you for improving your language and also the writing skills. And also you want to for your resume, they'll help you a lot for that. So try to use that one. And as they said, use the be do some volunteering work in the Providence care. So I also done a 3 months volunteering over there. So it's better to do a volunteering work so that we can know the system, how the Canadian workplace look like and how the people will be working. So we have some experience from there also.
Excellent. Thank you so much, Clinton. Mitali, let's go to you next. Do you have any advice for current or future students, and any closing comments?
So, as I mentioned, I think you need to be more clear on your thoughts, where you wanted to go at the end of your semesters. Plan ahead of time. It took everyone around 5 months to look for a job, and at that the time when you pass out and until you get the job, it's the toughest time you face, because you are in a boat where you don't know where to go, and it gets difficult. My one takeaway from the course was communication is the most important key for an individual to get the job. And being as an immigrant or a new graduate, I think we don't have good language proficiency, or some, not all of them have it, but most of them are, because we are not native English speakers. So communication, you need to improve your communication, because sometimes you wanted to say something but you end up saying something else. And in order to work as an administrator or in any of the profession, communication is plays a vital role. Apart from this, I would like to end the session with this is like, just go forward. Don't look about what's going to happen next. Just think about it and go for it. Maybe it will help you to get the experience in the field. Not in terms it will benefit for monetary, or it won't benefit you for the permanent residency, but it will build up a bridge to the goal you wanted to reach later on.
Excellent. Thank you so much, Mitali. And then we'll go to Nick.
Yeah,
What's
so
your
the
advice?
yeah, so I will start with the takeaway. So the biggest takeaway from the course, as I mentioned, as Mitali mentioned, the communication is very important in healthcare organization. The clear communication is the key in the healthcare. So the biggest takeaway was the communication module. Also the professors, though they are very knowledgeable and experienced, and they have all the industrial experience, that makes program very easy. Advice to students, I would say, many of the panelists have already mentioned that plan ahead. Don't wait for your work permit. Some people wait until they get your work permit and they says like, okay, I will start my education evaluation when I get my work visa, or when I'll start applying for my job after I get my work permit. Don't wait, and do volunteering work, because that will help you apply your theoretical knowledge in real time. So when you start your course and you start volunteering at the same time, you will simultaneously learning both practical as well as the theoretical aspect, and you will also make great connection that would eventually help you getting job. That's the takeaway for piece of advice to the new students. Thank you.
Fantastic. Thank you so much, Nick.
Thank you.
And Pavna, over to you for your piece of advice for current students and any closing comments that you'd like to make.
I would say, in the whole program, we have been through a lot of subjects. I told you that your major subject communication that start from our day one. Like even the writing skills also, because they matters. And I forgot the exact name of that course. It was for the social. I remember the Karen was taking care of it. It was for the case studies, like for the social working. And means if you are good with the our laws, Health Canada's laws, like HIPAA, PIPEDA, and if you are good, means you are, these are all laws on your tips, they would help you, because most of the healthcare background, they want to know, like for the, because everywhere they want to know about the privacy breaches, they don't want to do kind of these kind of things. So if we have been gone through in our program, so we can mention these two things, especially HIPAA, PIPA and PIPEDA in our resume, so it makes our resume stronger. And secondly, means I told earlier that risk assessment, like a little bit of accounting, because most of the organization, they need uh, administrator to do some kind of billing things. So if we are good in these things, means we are having a good skills, so we can mention these things also in the resume. And which can, because most of the HR recruiter, they just cut the resume on these our uh, skills, and we can get a top of it on the in as compared to other appliers. And all in all, I would say, means little collection from the every course, and just keep on applying and align yourself as per the requirement of the jobs.
Awesome, fantastic advice. What a incredible panel we have. And I just want to again take a few moments to thank you for giving your time to share your valuable thoughts. I know there's a lot of people who are going to listen to what you've had to share. We will be posting the video from this session online shortly. So I know there are going to be a lot of folks that are going to benefit from the pathways that you have each taken, and it's really interesting to hear kind of the different takes that you have on what that pathway forward is. And I think that's the most exciting thing about the healthcare admin program, is that our students don't just train for one thing. They're going in so many different directions, and we have such capable, confident, and skilled folks out working now across Canada. And it really is an absolute joy to know that we've played a little tiny piece in your journey. So please stay in touch with us. Again, we really do appreciate you taking your time to connect with us as well, and to share your journeys. Hopefully you'll stay in touch. We've got that page online on the Facebook page. So if you want to stay involved there may be some students who would benefit from a little bit of guidance going forward as well if they reach out to you. So thank you so much, everyone.
Thank you,
Thank
Julie.
you, Julie.
Thank you, Angie.
Thank you. Bye.
Thank you.
Hi, everyone.
Bye.
Okay. Take care. Have a great rest of the weekend.
Thank you. Bye.
You too.
Bye.
Bye,
Okay.
Angie.
Bye, guys. Good, great to hear from and see each of you. Thanks for today.
Thank you, Angie. Take care.
You too. Bye, guys.
Bye bye.